Affordable health care. It matters. To my family, to your family. Being able to get the care we need when we need it makes all the difference. Under the HOPE negotiated agreement with the city must notify HOPE if the annual increase of the healthcare premium exceeds 10%. So when Mayor Parker announced a premium hike of 14.9% plus $12.3 million in cuts to healthcare benefits for city workers, HOPE members mobilized. We went to City Hall and HOPE members testified about the hardships they and other city workers were facing. Among those who testified on your behalf was Pedro Sosa, a father of 3 and sole provider. He expressed concerns about the future and whether he would be able to afford prescriptions for his kids. Leonora Isaac, a HOPE member with 20 years with the city, said the high insurance costs meant choosing between her house, her car, or food. She let the mayor know that the high cost of the city's healthcare plan left city workers with nothing to take home. Jim Matujic, he questioned the data behind the hike in the specialist copays, arguing that city workers are not abusing specialists. Who would want to see multiple doctors unless it was a necessity? Our President Melvin Hughes asked Mayor Parker to come together with HOPE and find a workable solution. The mayor listened and opened the books. Our experts found that the city overestimated costs and that bringing down the premium to 8.7% would allow the city to build reserves, cover medical costs, lower prescription drug costs, and reverse specialist copays. We presented our findings in July, and on August 11, 2013, HOPE made the front page of the Houston Chronicle. And then we shared our story with the public.
Paying more to get less. That's how one city leader described what's happened to many municipal workers when it comes to health care coverage. Mayor Anise Parker has said the higher employee premiums and co-pays were necessary to, quote, get a grip on the city's health care costs. Well, today the workers who've absorbed the impact of this cost shift shared their grievances with Fox 26's Greg Grugan.
For rank-and-file municipal workers, it was the deepest kind of cut, the kind that clips hard at a paycheck and cleans out savings. In February, Mayor Anise Parker lifted health insurance premiums by nearly 15% and drastically raised co-pays and deductibles across the board. 5 months later, city employees are struggling to meet their medical costs.
I'm one of them.
Isaiah Monroe is a 311 operator.
My blood pressure medication went from $30 to $160 a month. I'm one of them. I work with people whose whole entire paycheck goes toward paying medical deductions for necessary treatments.
City technology worker Shannon Thompson developed a chronic foot condition and now can't afford appropriate treatment because of the repeating $100 copays.
It has really made me have to make some tough decisions. Am I going to pay for a medical visit, or am I, going to have to pull from the rent to do that? Or am I have to pull from the car note to do that?
Unable to afford the higher premiums, some workers have dropped city coverage altogether, seeking lower cost alternatives or just rolling the dice that they'll stay healthy.
We're treated as second-class citizens.
My name is Calvin Miller, and I'm a heavy equipment operator for the city of Houston.
A 19-year veteran of city service, Miller's health has rapidly deteriorated. He claims the higher copays have taken all he has and left him feeling betrayed.
This city is growing leaps and bounds. Now all we're doing is ask the city to come back and give us what we've earned. You're not giving us nothing. You just give us what we've earned.
5 days later, Mayor Parker reduced the premium to 8.7%, lowered prescription drug costs, and reversed the specialist copays. All changes will take effect September 1st, 2013.
Brothers and sisters, my name is Melvin Hughes. I'm the president of HOPE Union, Houston Organization of Public Employees. Today I'm here to talk to you about the win that city employees have received today. Brothers and sisters, it's about us. We have made some change, serious change on our health care. Our co-pays have been rolled back from $100 to $60. That's a big change, brothers and sisters. You'll be able to see more of your money to take home to your family. Not only that, prescriptions costs have been cut. They're rebidding it back out. So therefore, you'll be able to go and get a prescription and be able to afford it. Not only that, 14.9%. It's been cut. The premium's been cut from that price to 8.7%. Brothers and sisters, we couldn't have done that without you. It took all of us to do this. I'm asking you, brothers and sisters, to stand together with your union. Come together, join us. We thrive together as one. We want to make real change here in Houston for city employees. We need you.